Hello and welcome. This is Health and Wellbeing and I am Lois Abbasambu. This week on Health and Wellbeing, we are looking at male involvement in the pregnancy process of their partners, and matron of Aleita Primary Healthcare Center shares some insights on the role of male involvement in pregnancy. We would also be bringing you details on the outbreak of diphtheria in Nigeria. Maternal morbidities and mortalities have been increasing due to the underutilization of antenatal care and skilled delivery attendants at a global level. In Nigeria, it is put at an estimated 512 deaths per 100,000 live births. Experts say lack of male involvement in pregnancy-related care is one of the contributing factors. Male partners or fathers are key support persons for many childbearing women, and their involvement in pregnancy, childbirth, and the postnatal period has beneficial effects on a wide range of outcomes related to maternal and child health and family well-being. Word on the street has it that men are perceived as breadwinners, and their main role in pregnancy and child support is financial. However, a number of men find it weird visiting the hospital with their wives when they are pregnant. Up next, Ibrahim Jamil and other men share their experiences on their involvement in their wives' pregnancy processes. Jamil and his wife just had their first baby, and they're in the hospital for routine immunization. He says pregnancy is not just a responsibility of the woman, but their collective responsibility as a family.
Since from the day we discovered she's pregnant, I understood and I believe that we are pregnant, not her. So every other process that has to do with growing up of babies, I should be fully involved. Every single antenatal, I was there with her, every single one. And if God is going to bless us with 10 more kids, I will be there for every single antenatal. During my antenatal process, I learned a lot of things. I don't even say she's going for antenatal. I said we are going for antenatal, or I am going for antenatal. So I learned a lot. I know the kind of positions she's meant to sit, how she's meant to walk, what exercise she's meant to carry out, and food she needs to eat, and a lot more, that I can actually make it easy for us when we get pregnant again.
At the General Hospital Warimpa, male partners are mandated to attend antenatal care sessions with their wives. On visit, they are taught on how best they can prepare for the child and the mother before, during, and after birth.
You need to support them emotionally. You understand? I said there that money is not everything. You may give a woman all the money that she needs. If she's not getting that much that she needs from you, to affect her emotion. You understand? And when the woman is not emotionally balanced because of pregnancy, there is tendency for her to develop what we call period psychosis after delivery. But she just look at nobody like me. Even my husband doesn't like me. Even my mother-in-law doesn't like me. My friend they don't show me love. My neighbor, she begins to think of many things. But if she's getting the attention that she needs from you, the love that she needs from you, even if other people outside are not showing her love, she knows that, I know my husband loves me. He will be there for me at all times.
It is a new experience for Suleiman, so he has a lot of questions.
So, those kind of strange things we've been able to manage this situation so far.
Not that she just likes disturbing you, but at that particular moment, that is what her mind wants. And honestly speaking, if you don't even show concern, and she thought she just look back and said, I bet don't disturb me, I can sleep, I'll go to work tomorrow. It will register in her brain that she begins to think otherwise. That actually, why did I put myself in this mess? I know myself. Why did I allow any man to just put me in this position? She begins to think about many things, and before you know it, can affect her. You understand? You might be going on the street where your wife will never tell you that she wants to buy food for all those mama food. She will tell you that, my dear pa, you ask her, what are we doing here? that food I want to eat. You will just be wondering, Nadia, are you okay? And you tell me, yes, I'm okay, I'm alright, but I want that food. Please don't deny her. She may tell you that Mama Ikechi, she's cooking one kind native food. I want to eat it. Please let her go and make Mama Ikechi. Eh? Let her go and make Mama Ikechi. Mama Ikechi will understand that that is what pregnancy. She will give her. You tell her, oh yeah, take the one that you want.
This is our first time. We've had story before. People's experiences. People have shared their story with me before. My friends who are married already. So at times it could be so annoying, but then being that she's my wife, and I'll have to live up to my responsibility. At times we might be driving and especially ice cream. She might just ask me to stop on the road and say she wants to get ice cream. She wants to get this. There's a particular spot that anytime when we are going back home like this, anytime we get there, she will always want to stop there. Since I'm used to it, at first I normally complain, but since I am aware that okay, this is what she always wants, this is what she always crave for, so I no longer complain anymore. Actually, I will say the journey so far is I can say it's challenging kind of, but then it is what we've been praying for after marriage. Now the prayer is for the couple to have a baby, and now we are expecting. And the journey so far, I as the husband personally, have been trying my best to see that I give her all the necessary support that she needs emotionally, mentally, and I've been trying as much as possible to make sure that I attend to her, to make sure that all our needs are being attended to. So in the course of all of this, I've been noticing kind of strange behavior in her, from the lecture we've received before. I know it's normal. It's quite normal with a pregnant woman. So we've been living with it like that, and we've been making sure that all our needs are attended to. This is my first time that I received lecture in here. Although, okay, the first time we came, I think they told us about our health, how to live a very good health life, and how to keep our environment clean. So with those lectures, it's so far it has helped us to to make sure we live in a very good environment, and to make sure that we eat a very balanced diet. Okay, like the lecture we received today, the nurse told us the behavior that we'll be experiencing, like when she's pregnant. I think that will definitely help us to know that okay, when she put up a particular behavior, we should know that okay, it is normal with a pregnant woman. So the lectures have helped, and it will definitely help us, in managing their situation.
The first one anyway. So when she registered in an antenatal anyway, so it's only her that's going. And you just only called me, they need this, they need that. I'll send money. So that's the thing. Sometimes the only experience I have that time, they ask me the thorough tests. Is this, that, they just give us, thorough, and my this thing was like a genotype. So they check all those ones. Apart from that, though this one is different. I didn't have this kind of lecture. The only thing, when she's come back home, she always tell me, look at what they lecture them in the lecture room and things like that, But personally, nobody called me for any lecture. I'm happy that I came and I heard what they said.
The women are excited that their partners are with them. They believe the training will go a long way in enlightening them on maternal care.
During my first pregnancy, there was no training at all. So when I gave birth, we were just quarreling up and down. He was not aware about this postpartum depression. So he was quarreling with me up and down. But the second one, he got he got the training, and after I delivered, he was the one doing all the house chores because I don't even have a house there. He was the one fetching water, taking care of me all through, watching bathroom and the rest. Even this third one sef, he's the one taking me for supplies, always carrying me around. I don't drive. He's the one driving me. He's my driver. He brought me here today. It has really reduced the stress for me because now I'll be here till 3. He will help me pick the kids from school. He will stay with them till I come back and stuff like that. He's more understanding now than the first one. That one we were fighting all through.
This is the first time he's gotten training from the general hospital. So like when he called me out, he was giving me money. I believe that there's a little changes because there's some things, some attitude he normally showed when I asked for money. But now he just give me the money without complaining.
It's very cool. At least it will educate them more on how to take care of their wife at home, what they should provide. Yeah, I like him being here today now. I believe it will impact a little. I don't know.
Actually, since the first time he came with me, everything changed. The first time, he always think that if me cooking and all those things is my duty, but as he came for the classes, he was taught a lot of things. His attitude towards it changed. He became more appreciative. Like whenever he see me in the kitchen, he say, "Wow, baby, you are trying." They say it's not easy, but you're already doing it. So I think it's good for the men to always follow the women to the antenatal. At least that way they will have knowledge of what we the women face while being pregnant.
Mrs. Ada Ejiofor is the matron of the Aleta Primary Healthcare Center. She tells us more on the importance of male involvement in maternal care. Thank you for joining us, Mrs. Ejiofor. It's nice having you on the program. So we're talking about male participation. I'd just like you to tell us in layman's terms, what is male participation?
That is involving the man in the care of the pregnant woman and the unborn child. So, and making the man know what is expected of him as the man during pregnancy, you know. That is because there are some men they smoke, some men smoke, but when they are involved in this care and they are being counseled about the pregnancy reproductive issue, they will know the hazard of smoking around a pregnant woman.
So why is it important that men are involved in the pregnancy processes of their partners?
While the male involvement is of importance, you know, the male involvement helps to support the woman during pregnancy, and is also as part of an example for the children of both of the parents, so that the male child will see how the father is helping their mother during pregnancy, so he too can practice same when he starts his own family, you know. Then you motivate the male, I mean the male involvement by counseling, especially when they come with their wives. You do counseling, you know, about on the reproductive issue. Then you can even play a video for them to watch and see how deliveries are being done, and how the male can also be allowed. Some males are allowed into the labor room if they request to see how the delivery is being conducted and what their wife passes through during delivery. One of the advantages of male involvement, you know, like this, like family planning, it will help for them to plan their family very well, because the man will be there as you are giving your health education, your health talk. You talk about family planning, you talk about the advantages and the benefits and all what. So the man too will be there to hear the lecture So thereby making it easy for both partners to accept family planning, thereby preventing unwanted pregnancy. I know what unwanted pregnancy can cause when the woman becomes pregnant and the man doesn't want it. It's a problem. But when both of them come to the clinic, they listen. The man also listen to the teaching and he say, oh, this family planning is good. Before you know it, you see that the man will even be the one to make a choice for the woman and say, this method is good. Let us adapt to it. And also, the male involvement is of advantage because it can help to prevent, to allay fear and anxiety in the man. You know, some men when they come to the clinic, when the wife is in labor, they are scared, they are afraid, they don't know what is going to be the outcome. But with the counseling, the health education, and everything they must have had during antenatal visits when they come to the clinic with their wives, they will be relaxed that no, these midwives, they are good, at least have learned something during the antenatal visit, so my wife is in safe hands, and you help to allay fear and anxiety. Even the woman also, the male involvement will also help to calm and relax the woman when she's in labor.
So how does this affect the women generally? That their men are there with them during antenatal care and when they need them the most. How does this impact the women?
It also helps to prevent postpartum mental disorder. You know, some after delivery, that is when they even start falling sick here and there. But with the male involvement, the man also will be involved in care of the baby, care of the woman, and so on and so forth.
So we know that this is something new that is being brought up, and quite a number of men are not necessarily very used to this process. In making men come for antenatal care with their partners, what have been the barriers so far that stops men from coming for the antenatal care?
There can be barriers with this male involvement. When there's a when there's lack of education, there's lack of knowledge, lack of limited knowledge about the reproductive issue, you know, the man too. Another barrier is some men feel it is a woman affair, so they don't bother to, their presence is not needed in the during pregnancy or delivery, so they think it's a female issue. And some men also they feel that's the barriers now because some male too, they feel that they may not be comfortable when they come to the antenatal clinic, since only women all over the place, they may not feel relaxed, and they may not like it, and they will feel uncomfortable staying in the clinic with women. And some male also, you know, they feel when they follow their wives to the clinic, that people will think they are being controlled by their wives. That's why they are following their wives to the clinic, which some that is most African men, they think like that.
So, as an institution, what do you use as motivation to make sure that these men come for antenatal care sessions with their partners?
This was a counseling, and we receive them. We receive them warmly, with the counseling, the education, the health talk. Unfortunately, we don't have a video to play for them, because if we have a video to really play for them, they watch how deliveries are being conducted. Seeing how it is being done, how the baby comes out, how you deliver the baby, how the placenta comes out. But unfortunately, we don't have a video play here. But the same counseling, we counsel. Is when you provide room for counseling, you know the men, they will be coming. You welcome them, you make them feel wanted, you make them comfortable. uh So, and by giving them a preferential treatment, that is attending to the woman first, to encourages them. Say, oh, is it because I came with my wife? That is why I was the first person to be attended to, despite that I was maybe number 10. It will encourage them to come. The others, when others will even hear, when they go back on, they say, daddy, you follow me next week, because one man that came with the wife immediately, in fact, they were even number 20, but they were number 1 to be attended to, just because the husband came with her. So it encourages other women to come.
So in all of this, still like us talk about the importance of antenatal care. Why is it important for women to come for antenatal care in all their pregnancies?
Yes, it's very important for women to come for antenatal care, because during antenatal, there are so many investigations that we carry out here, which some of them, they don't even know they have this disease or this disorder. So it's during this antenatal care that are able to detect some of these illnesses that some of them they have and they don't know, through laboratory investigations. We do their urine testing, we test for sugar, we test for albumin, we test for blood, leukocytes, VDR, that's venereal disease test. We do hepatitis test. We even do their blood group, their genotype, their packed cell volume, that is their PCV. Some they don't even know that their blood level is low. They don't know, but some they tell you, I always feel dizzy. They don't know that they have shortage of blood. So during all these investigations, during antenatal, that's when you detect some of these things, and you give appropriate management or treatment where necessary.
Thank you very much, Mrs. Ejefo, for taking out time to be here with us on the program. We do sincerely appreciate your presence. Thank you.
Thank you.
So in other news, the Federal Ministry of Health says it has recorded 123 confirmed cases of the diphtheria disease and 38 deaths in different parts of the country. A breakdown by the Nigeria Center for Disease Control showed that Kano had 100 confirmed cases and 32 deaths. Lagos had 5 confirmed infections and 3 deaths. Yobe 17 confirmed incidents and 3 fatalities, while Osun recorded 1 confirmed case and no death so far. Quite a number of people are bothered about the breakout of the diphtheria disease in the country. So in this segment of the program, the lead of the National Diphtheria Technical Working Group with the Nigeria Center for Disease Control and Prevention, Dr. Bola Lawal, brings us details on the diphtheria disease and what we can do to prevent ourselves from contracting it.
Diphtheria is a vaccine preventable disease, highly infectious, caused by the bacterium Corynebacteria diphtheria. It's actually a germ in layman words that's actually passed from person to person through respiratory droplets while coughing or sneezing. Symptoms actually starts at about 2 to 5 days after a susceptible individual is actually exposed to these bacteria. It could be as mild as things like fever, culture, sore throat. Then in severe cases, we have toxins being produced by this bacteria, and these toxins actually lead to some form of grayish white patches at the back of the throat, and when accumulated in high quantity or volume, will actually lead to obstruction of the throat as well as the air passage, thereby leading to difficulty in breathing as well as swallowing. In severe cases as well, this toxin can equally pass into the bloodstream, affecting the nerves, the muscles, and even the heart, and can even cause some form of bleeding disorder or abnormalities. And in very severe cases, it could result in death. It's been reported that 1 in every 10 individuals infected with diphtheria will actually die. Diphtheria is a disease that used to be very common worldwide decades back. However, with the inception of the expanded program on immunization in the 80s, we globally experienced a marked reduction in the incidence of diphtheria, of course, Nigeria inclusive, to the extent that it became quite uncommon, and healthcare workers, the population at large, at a point forgot in quote about diphtheria, considering the fact that it has actually drastically reduced in terms of incidence. However, with waning immunity and with suboptimal vaccination coverage, we are beginning to see the emergence of this disease. It's basically common in environments where we actually, or in population where we actually have low vaccination coverage. So that's essentially why we are having a kind of resurgence of diphtheria. It's not a question of spreading from state to state. It's essentially the bacteria is actually present in our environment. However, people tend to come down with diphtheria when the vaccination coverage actually goes down and the population is no longer being protected against the bacteria. In such situation, we now have cases actually coming up. Of course, just like every other disease causing death, we should be concerned, and it is the responsibility of us all to ensure that we take actually preventive measures that will ensure that we actually break the transmission of this disease and ensure that less people come down with the disease, and consequently having less deaths as a result of this disease. Most of the cases that we've been seeing recently are children between the age 2 to 15 years of age, and most of them actually have poor vaccination status. It's either they've not been vaccinated at all, or they've not completed their expected 3 doses of pentavalent vaccine. So this is something that is common to most of the cases that we've actually been reporting so far. What is the direct cause of diphtheria? Like we said, it's actually caused by a germ, by a bacterium called the Corynebacterium diphtheriae, and is actually transmitted via respiratory droplets from person to person or by contact with contaminated surfaces or objects. The most effective way of actually preventing diphtheria, like I mentioned earlier, is actually via vaccination. So we expect every child below 1 year of age to be vaccinated with the 3 doses of pentavalent vaccine. Aside that, we also expect that individuals that comes down with signs and symptoms suggestive of diphtheria present early enough to health facilities so that such individual can be investigated and attended to as early as possible. By so doing, it makes it gives the individual the opportunity of benefiting from confirmatory test, and if it's actually confirmed to be diphtheria, appropriate measures will be instituted as soon as possible. The good thing about diphtheria is the bacteria responsible for it is actually susceptible, treatable with common and readily cheap and readily available antibiotics. So if such individual is actually picked early enough, such individual will benefit from treatment, which will actually stop the individual from progressing based on the disease condition, as well as preventing the individual from spreading it to other susceptible individuals. We also expect that when an individual is confirmed as having diphtheria, close contacts such as people that live in same households or people that are actually handling these cases directly are expected to be followed up, and there's what we call prophylactic antibiotics, which is actually giving them some form of medications that eventually prevent them from actually coming down with it as well. So vaccination, which is actually very key, early presentation of cases as soon as possible to health facilities for investigation, and following up of contact are the major preventive measures for now that we have for diphtheria. So just like every outbreak, it is a call for us to actually improve our health security in the country, ensure that our surveillance system is actually beefed up and well prepared enough to actually tackle some of these diseases. So like I said, we are in a good standing as a country to actually respond to this disease as we have been responding to it, and we hope that the level of awareness and preparedness we actually span across all states in the country, and collectively we believe that we can actually combat this disease. Diphtheria is something that is a disease that is actually easily manageable. It is actually susceptible. The bacteria is susceptible to commonly available and cheap antibiotics. So when these cases actually confirmed, there are readily available antibiotics which are actually quite cheap that the patient can actually benefit from. For those that actually needs the diphtheria antitoxin, like I said, we have the diphtheria antitoxin currently being stockpiled in the country, and it's been distributed to some of the states, and we expect that patients that actually require it will benefit from it as the cases actually come up. Okay, so unfortunately, diphtheria is one of such diseases that is more prevalent among people of poor socioeconomic background. So we essentially see these cases commonly in people living in overcrowded environment, poorly ventilated buildings. And aside these environmental issues, we also have vaccination status being, like I said earlier, the major driver of this outbreak. So it is mostly prevalent, not just in Nigeria, even across the globe, in areas where we have suboptimal coverage of vaccination among children. So aside the poor socioeconomic living condition, the major factor responsible for this transmission is actually poor vaccination coverage. Just like every outbreak, it's actually a risk, particularly with those with poor vaccination coverage. So for individuals that are actually fully vaccinated against pentavalent vaccine, the likelihood of them coming down with the disease is actually far less than those that are not vaccinated. So for us, this more or less like a wake-up call and an opportunity to actually enlighten the populace on the need to ensure that routine immunization coverage, which is actually available to prevent against vaccine preventable diseases, of which diphtheria is one of them. We should ensure that as a country, we do as much as we can individually and collectively to ensure that children that are exposed are expected to benefit from this vaccination actually benefit from it at the right time. Vaccines are readily available in most, if not all, our primary healthcare facilities, or let me say public health facilities across the country. You walk to any general hospital, any private health center, most of them have a vaccination unit where routinely mothers and caregivers actually take their children for routine immunization, just like the way we take them for vaccination against measles, yellow fever, polio. We equally have vaccination against diphtheria, although embedded in what we refer to as the pentavalent vaccine, which is actually effective against 5 diseases, hence the name pentavalent. So the vaccine is readily available to children below the age of 1 in most of our public health facilities, and even in some private health facilities as well. Of course, it is free. All vaccines under the routine immunization schedule in public health facilities are actually offered free of charge. Yes, for now, vaccination against diphtheria for adults is contained in what we refer to as the TD vaccines, that's the tetanus and diphtheria vaccine, and this is particularly targeted at women of reproductive age group 15 to 45 years of age. However, with the based on the WHO recommendation, ideally outside the 1-year age group, there's supposed to be room for booster doses for children above the age of 1 as well as adolescents. So we are working closely at the national level with our National Primary Healthcare Development Agency to see how we can actually give guidance to the country as regards vaccination, particularly amongst individuals outside the 1 year of life.
And that's it on health and well-being today. Remember to take your children for routine immunization in order to be protected against diphtheria. See you again, same time next week. I am Lois. Appa Sambo. Do stay safe.